So if we take a closer view of cancer and look at the cellular level, what exactly is happening? Well, normally our cells in many of our tissues, particularly the intestine, the lining of our mouths, also the skin, our blood, are undergoing a homeostasis. New cells are born and other cells die, and it's very important that that balance is kept proper. You can easily imagine if that gets out of balance, if you have an extra cell division, a tumor can start to develop, or if there's a problem in the machinery that causes the normal cells to die in the regulated fashion, cells will also build up. So that's the basic problem that we're trying to understand the molecular basis of. So how do we treat cancer? For decades, we've been treating cancer, as I think you're all well aware, by surgery. If a tumor is detected early enough, a surgeon can remove it. This is extremely effective. Obviously, we're removing the entire cancer. Some organs, it's a little challenging. For example, a brain tumor. As Chris will tell you, it's difficult to remove a tumor from a part of the brain that's essential for the normal function of the patient. The other modalities of treatment, which you're also familiar with, are radiation and chemotherapy. And these are two forms of therapy that very effectively kill cancer cells by damaging the DNA of the tumor cells. By damaging that DNA, when that cell reaches mitosis and needs to replicate its DNA, it will be unable to do so because of all of the damage, and the cell will die. So why aren't these good enough? Well, surgery, even though by the surgeon's eye, as well as the best imaging technologies we have, it looks like the tumor is localized, the cancer can come back because there can be microscopic, invisible cancer deposits in other parts of the body that we miss. So for that reason, we often give radiation to get cells that are just outside of the surgical field. We deliver radiation through a beam that has to be focused in a specific area. But radiation has the problem, in addition to damaging the DNA of the tumor cells, it also damages the DNA of the normal cells. So you can imagine the consequences. Similarly, chemotherapy, which is given either intravenously or by pills and circulates throughout the body, can kill cancer cells throughout the patient, but also damages normal cells, particularly blood and bone marrow cells, and cells lining the gut that are dividing rapidly as well.